Hi, everyone. For those of you logging in, happy Sunday. Good afternoon, good evening to you all. We're getting ready to start in just a few more minutes. Just waiting for a few more people to log on. I'm excited. We have a very special guest today, and I am so excited to chat with her about uterine fibroids. So if you're logged on, use the chat feature on YouTube or on Facebook. Let me know where you're joining us from. As usual, I like hearing where you guys are logging in from. Feel free to say hi. Feel free to give a shout out to someone. And most importantly, please share the live link. Share it to your Instagram, your Facebook, your WhatsApp, iMessages, everything. Go ahead and share the live with your friends and family, women, girls, boys, men alike. We all need to know about this. So welcome, welcome, welcome. If you're here, say hello. Feel free to share the link. We will get started in 2 minutes. Hi everyone, I see you guys logging in. Say hello. Let me know where you're joining from. I have a very special guest for you this afternoon, and I'm excited to get started. So welcome to you all. For those of you logging in for the very first time, welcome. You are not going to be disappointed. And for our usual viewers, we missed you. Thank you for logging in again. Hopefully everyone can hear me now. Welcome, welcome, welcome to episode 15 of Focus on Her Live. We are a long way ahead. It's nice to see you all logged in and ready to chat with us about uterine fibroids, most commonly referred to as just fibroids. I have a very special guest, and I'm excited to introduce her. She's not a stranger to Focus on Her Live, and I'm really excited to have her back. If you're logging on right now, feel free to say hello. Use the chat feature on Facebook and on YouTube. You can share your name if you want to let us know where you're logging in from. And I want you to share the live. Send it to a sister, a friend, your mom, your grandma. Send it to anyone who's able to log in from any social media device. All right, so today my special guest is Dr. Kerry-Anne Perkins, and she is a dynamic obstetrician and gynecologist, OB-GYN, practicing in the state of New Jersey, and she has extensive expertise in global maternal health needs. She deals with problems of the female reproductive tract, contraceptive care, minimal invasive surgery, and she is super committed to fitness and a holistic approach to the healthy mind, body, and spirit. Like me, she is super passionate about women's health, and that's why we're here this afternoon to share our knowledge with you and to learn from you what's been going on when it comes to fibroids. Dr. Perkins, I must include, is from the beautiful island of Jamaica. She's also a captain in the United States Army Reserve. She's an avid scientific researcher, and she holds multiple degrees. And I like to think of her as an all-rounder. So today I'd like to welcome Dr. Perkins to Focus on Her Life.
Hi, Dr. Luke. Thank you so much. It is so good to be back here again. Welcome and hi, everyone. I am so excited for our conversation today.
All right, so we are going to dive right into it because we have a lot to talk about. So uterine fibroids, most people just refer to it as fibroids. Some people actually don't know what it is exactly. Can you just share with us what is a fibroid?
Yeah, definitely. I must state that fibroids it's a term that we use like socially. Okay, so the medical term is a myoma, okay, or a leiomyoma. So most people are not even aware of that. So just know if you hear of a myomectomy, it's because a myoma is a fibroid. And what it is a growth. It is a soft tissue growth, a smooth tissue growth that is almost like a ball. Okay, when you hold a fibroid in your hand, it's almost like a rock, it's hard. And these growths can happen in any layer of the uterus. Okay, so if you think of the uterus as just almost like a balloon, and in the wall of the balloon, you could have these growths that are there. So that is what a fibroid is.
All right, and one of the most, common questions when we speak about growth and, in the body, is this cancerous? Should we be worried?
You should always be worried, okay, but worried enough to talk to your provider about it, okay? 99% of fibroids are not cancerous, and people can live with them forever without a problem. But about 1 to 2% may be cancerous over time. And so speaking with your provider, you want to share those concerns. There are certain characteristics your doctor might look for to decide whether or not this might be a problematic fibroid. And so talk to them because they'll guide you with whether or not you're at increased risk.
All right. So to our viewers and Dr. Perkins, did you know that an estimated 20 to 50%, even as far as 77% of women will develop fibroids at some time during their childbearing years? So women of reproductive age, about 20 to 50% currently have fibroids, and up to 77% will develop fibroids at some point during their childbearing and reproductive years. And only about 1/3 of these fibroids are large enough to be detected by a healthcare provider, like during a physical exam. So often it goes undiagnosed. But what are some of the symptoms that bring patients to your clinic?
Yeah, so many different symptoms. As females, I feel like females will deal with a lot and changes that happen in their bodies and just think like, something is weird. So things like fullness, having fullness in your lower belly, feeling like you could be pregnant or even looking like you're pregnant and you're not, obviously. You could have most commonly heavy bleeding. That's usually the symptom that people show up complaining about because the bleeding is so heavy that they're anemic, they're feeling fatigued, they're tired, they're having blood clots when their cycles come. Their cycles may be lasting longer than they normally would, and these can cause a lot of pelvic pain also when you're going through your menstrual cycle. So these are the common reasons why people come in, but some of the more simpler things like pain with sexual activity. Some people will deal with that and think that, okay, it might be my partner, I might have an infection, it might be something else, when really underlying they have a mass or a fibroid that's causing pain during intercourse. But there are a lot of different, symptoms. Some could be mild. Some could be, so one person can have multiple while someone else might have none whatsoever.
I see. So that makes it really hard for patients to determine whether or not they should seek help. So my periods are moderately painful this month. Next month's a little bit worse. The month after that is almost unbearable. When should I be concerned that, maybe I need to get checked?
You should be concerned when you have a change that is new for you. Okay. If your period is the same as it was when you were 12 and you're now 30 and you're just like, my cycles haven't changed, I feel just the same as you go through, or if you do have some changes, just extremely minor, that's okay. But if you go from having your cycles being moderate to super heavy, that you feel like you're bleeding like a pipe, like a faucet is turned on, that's a problem. If you notice that your menstrual cycles took a turn for the worse, turn to the right, just very drastic from what you're used to, it's time to see a provider. If you start having a lot of pelvic pain, it's time to see a provider. If you have blood clots and this is new for you, you should see your provider.
So basically, any change. So that means as women and girls, we really need to pay attention to our bodies, to the changes that are happening with menstrual periods and everything else concerning reproductive health. And viewers,
when a change comes, don't accept it. Go to the doctors and be evaluated and be sure that it's not due to another problem.
That is true. That is true, because most times things go undiagnosed because we don't step up and we're not, bold and brave enough to seek help. But it's important to take charge of your own health. You're in control. It's your body, and you deserve the health care that we are able to provide. So if you have any changes, your periods are changing, your body's feeling weird, pain that you're not used to, find your OBGYN, find your primary care provider if you have one, and let us help you to figure things out. So we talked about what a fibroid is. We talked about some of the symptoms. And viewers, if you are logged in and you've experienced any of these things, feel free to use the chat feature. Let us know some of the symptoms that you experienced if you had fibroids, or if you're currently dealing with fibroids. We're interested and we would like to know. I know there are a couple of you logged on who had fibroids removed. So if you want to share about your journey, feel free to use the chat. There is one thing that I kind of wanted to point out, is the hormonal influence of estrogen when it comes to leiomyomas or uterine fibroids. So how does that work?
Yeah, you know what? When I think of hormones, I think of it being the food and the meat and the nutrition for fibroids. Fibroids loves hormones. The more we have is the more that they thrive and they flourish and they grow into something greater. Okay. Now, as females during your reproductive years, guess what? We are hormonal. We are 100% hormonal. While we can influence our hormones by our lifestyle, the things that we eat, sleep, stress, like all of these things may play a part, but because we naturally have this balance between estrogens and progesterones, these hormones are feeding the fibroids and increasing their likelihood of growing over time. And paradoxically, as soon as a female goes through the menopausal process, that transition that shuts down the hormones, what we notice across the board is that fibroids either stop growing or they start to shrink. And this only happens when you transition into that menopausal state. Otherwise, they're going to continue to live off of and thrive from the hormones that are naturally within your body.
Wow. So are you saying, or should we think that if we're taking anything, any exogenous substances that have hormones, maybe the food, maybe other medications, would those things influence fibroids if we have any?
It could. Absolutely. It absolutely can. And it's not to say that it's 100% the case, right? We're all very unique individuals. And what may affect my fibroids might not affect your fibroids the same. And unfortunately, there isn't a strict blueprint to say that, because you're obese, this is your problem with fibroids, or because you eat a lot of red meat, this is your cause. It's kind of hard to hone in on what the real problem is, and we don't really 100% understand. But what we do know is that when you want to look at the entire your entire page, your medical page, and say, what are my risk factors? What is my lifestyle like? What things could I change? How could these be influencing my hormonal status, my hormonal balance, and how could that be increasing the likelihood of having more larger fibroids, or any fibroids?
I like that you mentioned risk factors because I did want to touch on some more risk factors. So I guess we could do like a truth or fab segment.
Okay.
Will I have fibroids if I have a strong family history of fibroids? Truth or
There's a
fab?
there's a good chance that you can. There is some kind of like genetic component that research has shown that if your parents, like your mother, your sister, very close relatives have fibroids, a lot of fibroids, that your risk of getting it is increased.
I see.
Mhm.
Does my risk increase if I eat a lot of red meat?
It may. Research again shows that if your diet is full of meats, especially red meat, ham, these can predispose a female to having fibroids. And on the other hand, if you were to have more, your diet is filled with more green vegetables, fruits, we know that that counters not only your hormones, but it decreases the likelihood of developing fibroids.
Wow. If I have other medical conditions like hypertension, does that affect my risk of getting fibroids?
Hypertension is really, in general, a directly different type of disease. Okay, it's a disease that's affecting your vascular beds, cardiovascular problems, and fibroids have not been shown to be linked with hypertension.
All right, so that one is a fab. I hope you viewers are listening. And if you have any questions about risk factors, definitely use the chat. I see one question about diagnosis. We're going to come to that in a quick second because that's important. Other risk factors I just wanted to quickly mention: obesity. Okay, obesity is actually directly linked to your risk of developing uterine fibroids. So let's pay attention to our BMIs. Let's get out there, exercise, make sure we're eating healthy. So
Yeah.
let's segue a little bit to diagnosis. We have a question from one of the viewers,
Okay.
and the viewer is asking, how large can a fibroid be to see enlargement in your abdominal area?
That's a great question. I love it. So a fibroid, it depends on what your body size truly is like, first off, because someone who's thin, they may have a fibroid that is the size of, say, an orange or a plum, and they can kind of notice that there's a bulge there, right? Someone else who has a higher BMI may have that same size fibroid, but you can't really notice it because it's not protruding as much through the abdominal fat. So it depends on the size. I can tell you that fibroids can vary from a seed, like or a grain of rice, all the way to the size of like a basketball. Yes, a basketball, okay? Bigger than a child's head, almost the size of a child altogether, like a newborn. And so they can be extremely large. So if you can imagine, if you are carrying around a basketball over time, most people think like, oh, it's been a few years, I've just been gaining weight and, I just feel bloated all the time. But they're not realizing that this fibroid has just been growing over time and continues to grow and grow and grow. And sometimes you could look like you're 9 months pregnant. I mean, we've had fibroids. I've taken out fibroids that comes all the way from your pelvis, from your vaginal area, and it extends all the way up to your chest. Okay, that's taking up your entire insides. And so you can start to really see a difference. Or you may take them out, like surgically, I can remove them, and all of a sudden your tummy just caves in. It's just so flat because you've taken out this large fibroid that was causing that bulge that was there probably for many, many years.
And so that's incredible. I can't imagine the quality of life women who
Mhm.
have these huge fibroids have. I mean, unable to sit without feeling immense pressure, unable to work, really heavy periods that are almost debilitating. So if you're having any of these symptoms, again, you definitely want to get this checked out, because this is something that could be corrected. And we'll talk about treatment in a couple of minutes, but it's something that can be corrected, or at the very least, your doctor, your OB/GYN primary care can keep a very close eye on it so that it doesn't get out of hand.
And you know
So
what, Dr. Luke, a couple of other things I wanted to mention as we're going along this conversation. Sometimes it could just be urinary frequency, or just feeling like you need to pee all the time, or even constipated, where you're wondering why you can't really pass your bowels as you should. The larger those fibroids get, is more likelihood that you're going to have those types of symptoms as well. And the second thing I also wanted to mention too is that, people can have a fibroid that's the size of a basketball and have no symptoms whatsoever. So they will never know that they're there. So the size isn't necessarily indicative of the severity of the disease. Okay. So if I break that down a little bit more, like, you can have fibroids and be completely fine if you have 5 of them, and you can have one tiny one that's like the size of like a blueberry, and it's causing you, it's wreaking havoc in your life. And so having multiple or many or the size does not mean you're going to have symptoms.
all right, so segue off of that, one viewer is asking, a fibroid as large as a basketball, what kind of health issues can fibroids cause when they get so large?
So the things that I just mentioned, having difficulty urinating. If you can imagine, the bladder is like a ball, and if the fibroid is pushing up against it, it's not able to fill. So someone else can go hours without having to urinate, and you, as soon as you leave the restroom, you feel like 30 minutes later, I have to go again. It's time for me to pee again, right? Because it has no space to expand. Like, the bladder can't expand and feel like it should. Same thing with constipation. Fibroids can cause a blockage to your bowels, and the foods that are being excreted in your feces. It makes it hard to pass through the colon to be exited. And so you can have, I've seen where a person has feces backed up all the way through their system. It's called an impaction, where we have to physically, with our hands, go into the anus and the bowels to remove all the feces that's there. Why? Because fibroids can block the passageway and cause everything to back up. So those are the most common health issues, I would say. In general, fibroids kind of live in their own worlds, right? They take over your pelvis, but they kind of live in your own world. So they don't necessarily cause you to have like liver issues, or like we were talking about, like diabetes or hypertension. Those are independent factors, but symptomatically, they can just overrule your entire pelvic area.
They can. And another thing that women might experience is iron deficiency anemia. Because they bleed so much because of those fibroids. Periods are really more than what they're used to. They're losing a bit more blood. And you find that when they come in for their annual physical, wow, they're anemic. Why? Because they're bleeding a lot. So that's another thing that we could have at the back of our minds. If I have fibroids and it's really extensive, I could have anemia as well, and I need to get that checked.
And you don't want to sit with that for a very long time. I know some people get really nervous about having to remove them or do something about them, but if you think about the risks of anemia, you can bleed so heavily and so quickly from a fibroid that your blood levels can pour out so that your vessels are empty. And at that point, your heart is suffering, your brain is suffering, your liver, your kidneys, you can pass out, you can be unconscious. You can need a blood transfusion, which also comes with risks. And so at all times, you really want to look and examine what your risks are like, how you're feeling, versus the benefits of potentially, not saying you have to, most people can live with fibroids and be fine, but the times that it's necessary to remove them for your overall health.
I see. So, do fibroids often go undiagnosed for years? And if so, why?
Yeah, for so many years. I can tell you that I don't know how many of us are in this room right now, but there's a good portion of us that has fibroids, and probably a majority of us who may have fibroids don't know that they're there. Okay. So if you, because fibroids grow slowly over time, in general, they will grow about 1 to 2 centimeters per year, which is not a lot. So you may have even 5 of them, but they're just so tiny, and little bit over time, they're growing. And until they start affecting the other organs in your body, you may not know that they're there, or until you start having pain and heavy bleeding. So that's the reason why they go undiagnosed. And this is a part of the reason why we also encourage that you go and get your annual exams every single year, like clockwork, because a part of that pelvic exam, when we're feeling internally, we're not having, the exam just because. We're doing these because we want to check the status of your uterus. We're checking for masses like fibroids. We're feeling for them. We're checking your ovaries. We're checking the vaginal space, because through touch, we can often diagnose that there is a fibroid or a mass there because we can feel it on exam. And so, whether or not you're having pain or symptoms or a problem, you should still go in for your annual exam.
Agreed. I agree. So apart from this, physical exam, this pelvic exam, what other diagnostic means do we have? How else could we, recognize that a patient has fibroids?
Yeah, the most common way to go about knowing or diagnosing this by gold standard is an ultrasound, okay, or what some people call a sonogram, right? So an ultrasound is amazing at looking at the textures within the pelvis and the uterus and be able to diagnose whether or not those fibroids are there. Oftentimes people will find out, like, if they went to like the emergency room and they're like, oh, I went in for a pain, and then I had a CAT scan of my belly, and then they came back and told me I had fibroids, and I never knew they were there, right? So these are actually common occurrences. Like, people don't know until they do another test. So on that note, CAT scans can also diagnose them. If we see any complications or problems and want to know more about the fibroids that we can see, an MRI is then the next best way to go about that. But oftentimes we don't jump to like an MRI, because the best test is really an ultrasound.
All right. Thank you very much. So we went to the doctor, had an ultrasound for whatever reason. Okay, I have a fibroid. One viewer is asking, at what point does a fibroid become cancerous?
Excellent question. Most of the times the fibroids that are already present are not cancerous. Okay. So, which is why some people can live with and stay with fibroids for 20, 30, 40, 50 years and never touch them, because the likelihood of them being cancerous is slim. So, how do we know this? We know by the appearance of that fibroid. If you do an ultrasound over time, so say you repeat your ultrasound in 12 months or 6 months, and their fibroid is just about the same size, it hasn't changed much, or if it did, it grew a little bit and not significantly, those are more than likely normal, stable fibroids. Whenever there are fibroids that grow rapidly, they emerge, and oftentimes in like a couple of months, what was a normal, say, size of a plum turned into a grapefruit or a basketball in a short period of time. That's abnormal growth, which is often or could be significant of a cancerous fibroid.
All right. And let's say, okay, the fibroid seems, pretty stable in size for 2, 3, 4 months. Do fibroids sometimes disappear on their own?
So that's like, it's a good question. It's an excellent question. I love all the questions right now. They don't necessarily disappear on their own. But when you get through the menopausal transition, this is when on their own we see the greatest shrinkage or stability in the fibroids. While you're still in a reproductive, young, hormonal state, those fibroids often will either remain the same size or they increase in size over time. Can they change and shrink? They can, absolutely. But more than likely, they will remain the same size or increase.
Okay, that is important to note. Viewers, take note. And we are definitely getting to all of your questions here. I see some of our viewers asking about treatment. So we can hop on over to surgical and non-surgical treatment options. So let's start with the non-surgical because we don't want to scare anyone. What are some of the treatment options available to our viewers?
Okay, so non-surgical, and this is how I'm going to separate how I'm going to respond. Non-surgical means that you're not going to get an incision or cut anywhere on your body. Okay, and so on that note, most common treatments are going to be things like radiofrequency treatments, which means that these are waves, radio frequency rays that can be sent directly to the fibroid through your tissue layers on your body, meaning through your skin. It passes through and can cause shrinkage in fibroids. Okay. Patients can get something called an ablation, but really it's not so much to treat the fibroid, but to treat heavy bleeding. Okay. And what that does is that it kind of, it causes the inside layer of the uterus to become inactive. So it doesn't bleed and it's not as active as it normally is. Outside of that, there's something called an endometrial, a uterine artery embolization. And what that means is that we are placing like particles into the vessels that feeds and goes into the fibroids. So essentially, we cut off the flow of blood and hormones and everything that goes to the fibroid that causes it to thrive and grow, and shut that down so that they will starve and shrink over time.
Okay, so quite a few non-surgical options. I know that one of our viewers was asking, I'm trying to find the question right here, something to do with birth control. Let's see. You guys are asking a lot of questions. I love it. How effective is birth control in regulating your cycle because of fibroids?
Good question. So, birth control is really good with helping your hormonal causes of heavy bleeding. Okay, so it kind of controls the hormones there. If there is a fibroid that is causing you to have heavy bleeding, using birth control is almost like putting a blanket on it, but the problem is still there. You want to remove a fibroid that's causing heavy bleeding. And if you don't mind, I'm going to show you a little diagram here, okay?
Okay.
All right, so this here is a cross section of what the inside of your pelvis. There you go, okay? So this is the vagina here, okay? This is the entire uterus here, ovaries, and then these are your fallopian tubes here, okay? So this is a cross section here. Inside of your uterus, you have different layers. So this space in here, this is where bleeding comes from. This is your menstrual cycle. This is what bleeding, any kind of bleeding comes from, right there, okay? That space and comes through the vagina here, right? Now, if you can see here, this is the muscle of the uterus. And then if I flip this over, this would be like the outer area of the uterus, okay? Now, fibroids can be located in any of those three layers. So on the inside here, in the muscle, or it can hang off or be on top somewhere on the uterus, okay? Now, if fibroids are up top, hanging off, most people completely okay, have no issues, may have bloating, may feel like their stomachs are growing, but they don't have bleeding, they don't have much pain, okay? Now, fibroids that are within the muscle here also may not cause any bleeding, might have some pain, but might not have any bleeding whatsoever. Fibroids that cause heavy bleeding are often here in the center, okay? These are called submucosal fibroids. Anything that's in this space here, even if it's like a polyp or some other problem, anything in this space causes heavy bleeding. Now, if you're taking birth control to control bleeding, the problem is still here. And so instead of being on hormones to try to control the bleeding, it's probably better for you to have a simple procedure. We didn't talk about surgeries yet, but one of the most simplest surgeries would be to pass through the vaginal space as if you're getting a pap smear done. And we go inside and remove the fibroid that is there. It takes a few minutes, and a few minutes meaning like 20, 30 minutes maybe, to remove that fibroid. And then you wouldn't have that heavy bleeding anymore, as opposed to fighting the bleeding issue by taking hormones constantly. Because the minute you stop taking those hormones, guess what? The heavy bleeding will continue over time. So hopefully that made sense.
It did to me. So viewers, if you didn't understand, please let us know. Dr. Perkins, we have a diagram that I could put up if you want viewers to see that.
Yes. Good. So so what you're seeing here, everyone, again, is that cross section of the uterus. Okay, so you can see the space on the middle. Can you actually see my mouse here?
We cannot.
You cannot. Okay. So those white balls that you're seeing there, the diagram is actually pointing to the fibroids. They're very white and they look like little swirls. Okay. Those are fibroids. And this image here is probably showing fibroids that are the size of maybe, I want to say maybe a grape, a little bit bigger than a grape. So these are not large at all, even though they might look large to you. Okay. So those are fibroids. And again, they can be located in different places. Now, in that space in the middle, you have one that looks like it's poking in at the top, hanging down. That is the one, or one of the two, I would say here, that may cause bleeding issues. And so even if you had like an IUD, if you were on birth control pills, like it doesn't even matter the type that you're having, that fibroid comes with blood vessels on its own. And that blood vessel, when it's time for a cycle, opens up the floodgates. It just pours blood out and does not listen to what your body does. It does not listen to hormones. It doesn't listen to birth control. It does whatever it wants to do. So you may be taking this medicine to help with the bleeding, but really it's not helping much. Okay. So when you have a problematic fibroid, really the best recommendation I would make for you is to actually remove them for your overall long-term health.
Okay, so removal, we're talking surgery now. What is the name of this procedure that we do to remove the fibroids?
Okay, so myomectomy. Okay, so remember I said that the name of fibroids are myomas. And so when you say ectomy, is to remove it. Okay, so you're removing with a myomectomy. And that myomectomy can be done in several different ways. So the one that I just mentioned, where you go inside through the vagina, you go into that space and you remove and clear out whatever is there, that is a hysteroscopic, okay, myomectomy. All right. Now, if the fibroids are elsewhere in the uterus, then the best way to go about those, depending on the size, meaning they're significant in their problem, is to go through the abdomen. So that's called an abdominal myomectomy. Okay. And so those can be done laparoscopically. They can be done robotically. We go inside or we open up almost like a C-section and remove those fibroids depending on the scenario.
All right. And our viewers have lots of questions about the surgery part of it. So can fibroids return after surgery?
They sure can. Okay. And they absolutely can. If you have fibroids, you are predisposed to getting fibroids. And the likelihood is that you're going to get more fibroids. Okay. Every now and then you'll have a person that will only have one, and that's it. But more than likely, when we're doing these surgeries, we can remove 20, 25, 30 fibroids because there are so many of them. Now, they all start off as being like little seeds. So within the muscle of the uterus, there can be so many little tiny seeds. There could be hundreds of them. And so when you get the procedure to remove them, sometimes it's very difficult to get every seed of a fibroid that is there. And it's not it's too risky to go about that. So oftentimes the surgeons would, like, we will take out the ones we must, the ones that we can see, the ones that won't cause any problems, or the ones that won't cause problems with the surgery to remove, so that we can take out as many as we can, so we have less likelihood of this happening again. But it's also very common that you may need to get a myomectomy or the surgery more than once. Okay, so if you're young and you're still using your uterus, meaning that you're still planning for fertility, for children, and you're not done with that yet, then oftentimes we may recommend doing this procedure more than once, because a risk that we didn't talk about is miscarriages. Okay, or difficulty getting pregnant or infertility. Okay, both of those are commonly caused by fibroids. And so you want to weigh the risks and talk to your provider so we can make the best recommendation, and talk about a plan together for the long term. Now, if you're set and you're just like, I'm done having children, I'm not using my uterus anymore. My uterus is for two things: periods and pregnancy. We're done with the pregnancy. Really don't care for the period so much. Sometimes the next best option is to do a hysterectomy, which is just removing the uterus and all of the components with that. So if this is the uterus and you're getting a hysterectomy, remove this entire space here so that the fibroids and everything gets removed, so you're not at risk of bleeding and anemia and pain and all the problems that may come with having large or problematic fibroids.
All right, that's a mouthful for our viewers. One person is asking, what's laparoscopically? Because we're hearing all of these medical terms, and can you just break that one down for them?
Yes, laparoscopic means that we are making very tiny incisions. Usually the incisions are as wide as my fingertip here, okay? And so we make very tiny incisions on your abdomen or on your belly, and often it could be anywhere between 3 and 5 incisions. And with that, we place instruments through the belly, and we surgically operate and remove your fibroids and take them out through that space as well. So we're not giving you a large incision. So if you think of a C-section, that would be an open surgery. Okay, laparoscopic means those tiny little incisions, and it's recommended oftentimes if it's safe for you, because you heal a lot faster, you have less symptoms, less scarring on the inside, you can return to work a lot faster. So there's a lot of reasons why we might recommend that. Robotically is pretty much a laparoscopic surgery, but we have a robot controlling the instruments that we're using. Okay, so same small incisions, but we're also using a robot to help us navigate and perform the procedure.
Awesome. Now, we mentioned infertility, and I'm sure some people's hearts skip a beat right there. There are patients who get pregnant and they have fibroids, big ones at that, and they're able to carry a pregnancy to term. So it's not impossible to get pregnant and to give birth to a healthy baby if you have fibroids. One viewer is asking, is it best to have surgery before or after having children? Before I let you answer, Dr. Perkins, we had one patient who had to have a C-section delivery and had a fibroid, had a big one at that, and was able to deliver a healthy baby. So in your practice, what have you seen?
Yeah, so it all depends on the size and what kind of problems you're having with that. Remember, many people can live with fibroids and it not be an issue. Okay, now complications of having fibroids or during or before pregnancy, again, miscarriages. So we know that fibroids will fight with a growing baby. They fight, and guess what? Fibroids often win. Okay, so they're taking blood flow that your baby should get and deserve. They're taking up the space in your uterus that your baby should use, right? And so risk during the pregnancy has to do with your baby not flipping in the right direction that it needs to have a vaginal birth. Why? Because the fibroid is fighting with the baby and preventing your baby from moving and going about inside the uterus as it should. When at the point of delivery, a big risk is bleeding. A big risk. So when you're planning for pregnancy, you want to talk to your provider about what is my risk of having hemorrhage. Hemorrhage means that you bleed out quickly at the time of your delivery, immediately after, or even sometimes a few days after. And the reason is if there's a big fibroid there, it prevents your uterus from doing the things that it needs to do to stop bleeding when your baby's delivered. And so that risk is very, very, very high, depending on the size and the location of the fibroid that you have. So, can you go ahead and go through pregnancy? Yes, absolutely. You can go through, you can have a beautiful pregnancy and not even know it, that the fibroids are there. But sometimes, depending on where they are, they can really cause a lot of problems.
Yeah, and we also need to consider the rest of your medical history when helping you to make those decisions, whether or not you're going to have a high risk pregnancy or whether or not things are, pretty much be smooth sailing. So it's always important to talk to your doctor, talk to your provider, lay everything out on the table so that you can make a very informed decision. All right, viewers, you have been amazing today with the questions. We have a few more to take before we wrap up. One viewer is asking, what causes fibroids to return months after a myomectomy?
Yeah. So, what often happens is that those tiny seeds that were still there during the procedure, okay, continue to grow and get life and grow and get bigger. And oftentimes, it could be that the spacing that was limited before, now that those other fibers are gone, now these seeds have a lot of room to go ahead and grow and have life. When those fibroids are removed, there's a return or there's an increased amount of blood flow that goes to the muscles of the uterus to heal. But guess what fibroids like? Blood flow and hormones. So as that healing is happening, it could be feeding into those tiny little seeds that are around there and cause them to kind of sprout up and grow into fibroids, or bigger and larger fibroids, I should say.
Okay, so now what can I do to prevent fibroids from occurring?
Good question. Okay, now genetically and with life, again, 80% of us probably by the age of 50 may have fibroids. Okay, so you're as a species, we're all already predisposed to getting them. But your diet, you want to try to maintain a lifestyle and diet that is great for hormonal balance and great for health overall. If you do that, you keep your weight healthy, you're exercising regularly, eating lots of fibroids. Fibroids help to balance that hormonal or prevent hormonal imbalances within our system. So you want to eat lots of fiber, drink lots of water, exercise. That's the best thing that we can do for ourselves on a daily basis to help to prevent that likelihood of happening.
All right, and regular checkups, okay? Stay on top of it. Make sure you're going for your annuals. If your doctor has you coming in more than just once a year, stay on top of that. Most times it's surveillance. We're just looking at your hormone levels, looking at the size of the fibroids if necessary, and we want to make sure that everything stays in control. All right. Yeah. So pretty much we talked about a lot of things today. And viewers, as you think about your last minute questions, I'm going to ask Dr. Perkins to share any advice that you have for women living with fibroids, because it is not an easy road for them.
It is not. It's a painful or could be a painful road ahead. At all times, you want to be informed. So this is a part of the reason why I encourage and I teach so much, because the more that we know as people, the more conversations we have, the more we talk about these things. One, you realize it's a lot more common than we thought. Okay, so it's not as taboo, but the more you will also read and research on your own. Because when you go to your doctor and your provider, when you are able to investigate yourself and communicate that to your doctor or your provider, you'll enable a better relationship and the likelihood that you're going to get appropriate care. Okay, while Google is easy, it is very easy and you can learn for sure, talk to your providers so that you can know what's best for you, what's the best option. Do you want to live with them? Can you live with them? If you want to remove them, and if so, when would be the best time to do so? Or by what means, what mode should we go about taking care of them? Do we want to shrink them or remove them? Do we want to leave the uterus? Do we not? And so you want to talk and have a relationship with your doctor. Your doctor will likely be the one to help you along the right path and to give you recommendations and inform you well so you can make good decisions about the fibroids that you have.
All right. So you heard it from the professional herself. Ladies, please do not suffer in silence. Men, you are now informed as to what's going on. We don't expect you to remember every single thing today, but if at all you have to remember one thing, remember that you are in control of this. Okay, we are here to help, guide, and treat, and we want you to take charge of your health. So if you're experiencing any of these symptoms that we discussed today, or maybe you've already been diagnosed with uterine fibroids, you want to be able to live the best quality life that you can. And that means taking a couple steps to having that kind of enjoyment in life. Staying on top of your visits with your doctor, making sure that you exercise, stay fit and healthy, eating well, and everything else that Dr. Perkins mentioned. And if there is anything else that you need from us, please feel free to contact us. You can find us online, focusonher.net. You can find Dr. Perkins on Instagram. Dr. Perkins, do you want me to drop your Instagram handle?
Yes, sure. It's the same on Instagram, TikTok, and I'm starting YouTube. So it's all call me Dr. spelled out P. P. And I also have my website that will be launching soon. I have such wonderful and great information that's coming out on the website. So if you stay tuned as well, that will be dropping in a few weeks.
All right. I love it. We are here for women's health, women's advocacy. I am going to drop your Instagram link. For those of you on YouTube, you're able to click on that. I'm also going to drop it on Facebook for those of you logged in there. Please take a look at Dr. Perkins' content. It is amazing. As for Focus on Her, we have a special article coming out for you. Yes, fibroids, and it's an amazing story. So please look out for the next article next week and stay tuned for any other live events that we have in the coming months. Thank you so much for your questions. Ooh, we have one more. Do we have time? Dr. Perkins, can you take one?
Yes, I love it.
So one viewer is asking, if the fibroids are very small and not causing any issues, can I still opt to have them removed?
So at all times, we want to weigh the risk and the benefits. Okay, so what does that mean? Some of the most common risks of surgery is that you're going to have an incision. That incision abdominally is going to create scarring. Whenever we get a cut, we get scars, right? So internally, we get a lot more scarring. And scars over time can be a problem, okay? So scarring is one. During surgery, it doesn't matter if it's laparoscopic, robotically, open, we are also at risk of having bleeding during the procedure. So we have to think about that risk as well as pain. Having scarring on the inside can cause pain that's from scarring, not necessarily from the fibroid but the removal of the fibroid. And so small fibroids, if they're not bothering you, oftentimes we don't encourage that you take them out because the risk of you having that bleeding or scarring or the pain afterwards is greater. Okay. Now, if you're very symptomatic, they're problematic, they're in a bad place, that's different because that is a greater risk to your life than continuing with them. But if they're very small, I don't recommend. We want to leave your abdomen and your belly what I call a virgin. Okay. You want it to be untouched. And because, as we get older, we have other risks. We can get an appendicitis and might have to get the appendix out. You can have a problem with the bowel or your pancreas or your liver. And so you want to keep your inside as pristine as possible for any possible need of surgeries later on in life, because every surgery you get, okay, so imagine you remove those tiny fibroids now and some seeds are left behind. And in 5 years, those seeds turn into oranges or grapefruits. Now you'll need a second surgery to remove them. And every surgery can cause more complications for you. And our goal is to get you to stay and remain healthy as much as possible. We don't want to do harm. So if they're small and not bothersome, I would recommend just leaving them and leaving your body as is until it becomes a problem.
Okay. And we have talked a lot about this topic today. I feel great about it. Thank you, Dr. Perkins, for sharing your wisdom and knowledge with us. Thank you, viewers, for logging in, asking all the questions, and for sharing your knowledge with us as well. We will see you next time. Again, Dr. Perkins, it's been a pleasure. Thank you,
Oh,
everyone, for joining episode 15.
yes. Thank you, everyone. Thank you, Dr. Luke. It's been a pleasure as always. And whatever you're going through, I just say go ahead and advocate for yourself and know that there is help available, and talk, 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 talk. Ask questions, okay? You can't ask enough questions.
All right. Have a good evening, everyone. Enjoy the rest of the weekend. Bye for now.
Bye.